Hello, my name is Cashell Lewis. I'm a PhD candidate at the University of Chicago's Crown Family School of Social Work, Policy, and Practice. First, I want to thank you all for listening to my presentation of my abstract of my paper I co-authored with Christina Andrews, Amanda Abram, Alyssa Westlake, Faye Taxman, and Colleen Brogan. The title of this paper is State Medicaid Initiatives Targeting Substance Use Disorder in Criminal Legal Settings, 2021. Medicaid initiatives are extremely important for individuals involved in the criminal legal system, especially during reentry. Over 60% of the incarcerated population reported a substance use disorder. More than 600,000 individuals are released from prison, and another 9 million cycle through jails every year. And 80% of these individuals return into the community without health care coverage. And many would qualify for Medicaid services. This absence of coverage contributes to the lack of continuity of care and treatment. Health services initiated during incarceration frequently stops upon release. This leads to a higher mortality and higher drug overdose. Pre-release Medicaid enrollment assistance increases the likelihood of visiting a substance use disorder treatment outpatient facility within the first 30 days of release. In our current investigation, many states have implemented substance use disorder treatment initiatives within the criminal legal system. However, there's no systematic study of which states have adopted programs and what initiatives they pursue. So what we did, we conducted an internet-based survey of Medicaid programs across the United States. Each Medicaid director was emailed a study packet and a survey link. Follow-up emails and phone calls were made in order to fill in for missing data, and we received a 90% response rate. So here's a snapshot of the survey questions that we asked each director. They were to look at this and to check which initiative they are engaged in and what setting, whether it was prisons, jails, or community corrections. We decided to group these results into 3 separate groups. The first group were looked at initiatives related to medication for opioid use disorder, which 17 states adopted that in at least one setting. The next one was initiatives related to Medicaid enrollment, which 17 states also adopted that in one setting. And the last was the initiatives related to substance use disorder care coordination, which 11 states adopted. So what we found that only 11 states adopted substance use disorder care coordination models for individuals leaving the criminal legal system. All the states that supported Medicaid initiatives are Medicaid expansion states. Initiatives were most commonly adopted in prison settings, which makes sense. Individuals are in prison for a longer period of time, where you can be incarcerated in jail for less than a day or maybe sometime hours. But states most commonly supported these initiatives here, which is first was the provision of medication for opioid use disorder just prior to release. And the second was the facilitation of Medicaid suspension rather than termination. Current policy states that individuals, once they're incarcerated, the Medicaid membership has to be terminated. Some states have engaged in initiatives to just suspend it. So when those individuals are released, the process to getting reinstated it's a lot simpler. So in conclusion, we found the states' involvement in Medicaid initiatives remained extremely low. 2, we increased adoption of Medicaid initiatives are needed, especially when this population already has extremely high rates of overdose and mortality. While it is concerning that most states are not involved with Medicaid initiatives, some states may be involved with other health initiatives within the criminal legal system. But given the public health benefit, it is important to know what initiative states are involved in. I want to thank you for taking the time out to listen to this presentation. Check out this paper at the link below.